Namaskar, friends. Today we will check one criteria which can ensure or which can tell us about 80% of our health. What is that one criteria? We will examine it today. Friends, this gut health, insulin sensitivity, D and B12 vitamin adequacy are the keys to your health. If you can make sure that these three, four areas, and you can be well off. Like we discussed this and many times about this lifestyle disorders, lack of hydration, constipation, poor appetite means if a person is unable to go to the bowel movement in the morning, after wake up, immediately after wake up, or within about 15-20 minutes, and he's going to the stools during the day, you can consider he's constipated. It's necessary that he has to go immediately after wake up. You must be able to go to the stools. Maybe you can have the assistance of 1 liter water so that it will help. Inflammatory foods, we are taking refined foods, packaged foods, and all that should be avoided. Lack of nutritious foods, we're not eating the right food like sprouts, fruits, and nuts, etc. Insulin resistance, we discussed this many times. This is happening because of multiple eating, like breakfast, lunch, dinner, snacks, coffee, tea, eating 6 to 7 times in a day. Over the years, maybe it takes 5-10 years, then become insulin resistance. Lack of exercise, lack of 7 hours night sleep. Important is the night sleep. Poor mind management, we don't know how to handle our mind, we don't know how to respond things, and getting into problem like chronic stress, anxiety, and all that. And D and B12 vitamin deficiency is very prevalent now because a lot of people don't check, they don't know. Many people are deficient with D and B12 over a period of time. This happens 5-10 years. This can cause chronic inflammation and hormonal imbalance that will lead to disorders. First thing is fatty liver, obesity, pre-diabetes, diabetes, hypertension, PCOS, CVD. Now the question is that what happens first, we can't say. Now look at it, friends. This is what I'm saying. One area, if you are able to know what is your insulin resistance, where you are, for that you need to do two tests only, rather three tests. One is fasting sugar and HbA1c. This is commonly done. Most of the health checkups, if you know, they will always be talking about this thing. See, if your fasting glucose is below 99 milligrams per deciliter and HbA1c is below 5.6%, that means what? See, the body is maintaining it. It's a controlled parameter. Over the years, many years, you will see this is there, but what all can be happening to him is that insulin is going up, which is not measured and not known. See, I've seen many people, their probably HbA1c levels are below 5.6%, and most of the time their sugar levels are so low, but they're already obese, they have fatty liver, they have PCOS problem, and they also have, sometimes people have heart problems and they have got put stents also. And I'm surprised. How come when these parameters are good, and why this still chap is happening? I mean, going in this wrong direction. So I met a guy in one of the program, Antana's ashram, and he's 33 years and he would be around 110, 115 kg. He's not able to walk comfortable. He came for the program for 15 days. I asked him, how is your blood reports? He said, yeah, my brother is working in a hospital. I got my blood test done. I spent 4,000 rupees. All parameters are okay. Now the question is, if all the parameters are okay, why are you like this? It's a elementary question we must ask. So he says, I don't know. I said, yeah, because I'm sure either they have not checked certain key parameters or certain parameters which are taken. Their range is so high, you presume that you are all right, which you are not. The body is giving a clear signal that you are obese, you are not able to walk. At 33 years, you have these issues. Maybe you're not taking any medication because still body has not broken down. So fasting insulin is taking is a must, friends. See, when you see your 3 to 5 many liters is there, and then fasting glucose is below 99, your insulin sensitivity is very good. It's below 1.5. Anything 1.5 is insulin resistance. Insulin resistance means six pack. So he could be having any health issues like fatty liver, obesity, diabetes, hypertension, PCOS, CVD, etc. Now, when you have insulin resistance, if it is above 1.5, and then over the years, maybe the HbA1c also goes up. Many times I have seen people, insulin resistance is 3 or 4. Even then, their HbA1c is below 5.7, and they think they're all right. Only because they have not checked the insulin resistance, they don't know what can all happen with insulin resistance, friends. He can get diabetes, fatty liver, obesity, dementia. All these things can happen. So, what is the way out? So, once you check this, once you know your insulin resistance, what needs to be done? Look at, friends, wellness secrets daily schedule. Direction is more important than speed. Many are going fast but in wrong direction, right? So what needs to be done? 3 to 4 liters water consumption every day, two bowel movements every day, 45 minutes brisk walk, 7 hours sleep at night, mind management, do some yoga, learn certain programs, so that would help you to manage your mind, avoiding stimulants and processed food. Stimulants is what? Coffee, tea, alcohol, tobacco, and all that. Processed food is all this packaged food, factory made food you must avoid. Now the question is, eat only twice when you're hungry. See, many people tell you about this intermittent fasting is very famous. So 16 hours fasting, a lot of people do. They get definitely good benefits. But that eating hours, 8 hours of eating in India, if they are taking number of times more, the advantage will be very minimal. So the best thing is eat only twice. There is no restriction for your type of food, quantity, timings. So you choose. Only thing is you need to maintain the same timings, eat when you're hungry, and this alone can take you up. And this will ensure what? This will ensure your gut health, insulin sensitivity, and you please check D and B vitamin levels, B12 vitamin levels. D vitamin should be 60 to 80, B12 should be around 600 to 800. Friends, these are the few people who have benefited by following this Wellness Secrets daily schedule. And I'm sure there are videos I have explained in detail. And my name is Gangeshwar Rao. I'm not a doctor, and I have improved my health. I'm sure if you have this knowledge, you can improve your health. Take your health in your own hands, friends. Knowledge and discipline are the gateways to your health. And thank you for listening to this talk. And there are a lot of videos in my YouTube channel. Please listen. If anybody wants any support or help, they can send their reports to me. I can guide them. This is my mobile number. Thank you very much, friends.